So I did my project on a genetic mutation called Porphyria. Basically what it is a buildup of natural chemicals that produce porphyrin in your body. Hemoglobins need porphyrin in order to function. Hemoglobin is a protein in red blood cells that carries oxygen to organs and tissues. People who lack the enzyme that completes the process for him have a build-up of porphyrin and is what causes this disease to form. It mainly affects the cutaneous and nervous system. So some symptoms and how people are affected when they have this disease is, well, there's two types, which is acute and cutaneous. Acute porphyria mainly affects the nervous system. Some side effects, some symptoms may be severe abdominal pain, pain in chest, legs, and back, constipation or diarrhea, nausea and vomiting, and muscle pain. For the cutaneous porphyria, it affects the skin, and some symptoms it could lead to are sensitivity to the sun and sometimes artificial light, sudden painful skin redness, blisters on exposed skin, and fragile thin skin. Some treatments for acute porphyria are they'll do injections of hemin, which limits the body's production of porphyrins. Glucose is taken to maintain a normal level of carbohydrates. One will be hospitalized to get treatment for severe pain, vomiting, dehydration, or problems with breathing. The treatments for cutaneous porphyria are they'll draw your blood periodically to reduce the iron in your body, which decreases the amount of porphyrins in your body. Taking drugs that treat malaria to absorb the excess amounts of porphyrins. And due to lack of sunlight exposure, they'll give you vitamin D supplements. Can it be cured? Since porphyria is inherited, it cannot be cured. There is no medication that can aid in reducing the amount of porphyrins that are reduced. There's only treatments for the symptoms it causes. So how is it inherited? This disease is inherited from one altered gene from one parent, which is the autosomal dominant. Another way it can be inherited is from inheriting two altered genes from two parents, which is autosomal recessive. Is it common? Porphyria is a rare disease. The exact number of people diagnosed with disease is unknown, but it most likely ranges from 1 in 500 to 1 in 50,000 worldwide. Only 10 cases have been reported worldwide, and those cases were all males. The reason why the exact number of cases is still unknown is because some people who have porphyria don't show any signs or symptoms. The average lifespan of people who are diagnosed with disease usually have a normal life expectancy unless they are diagnosed with an acute hectic porphyria. This is because they have higher risks of developing high blood pressure, chronic kidney disease, and liver cancer. What have I learned? I have learned what porphyria is and why people get this disease. I still had a couple of questions, such as why no one knows the exact number of people who are diagnosed with this disease. The following slide is my works cited.